Okay. We'll give everybody a couple of minutes to come in. As you're arriving, it's the Beyond Celiac Town Hall for July 2023. Really excited to have our guest today, Juanita Belton. They're coming in. I'm Claire Baker. I'm the Senior Director of Communications for Beyond Celiac. We are excited to bring the Town Hall series to you every other month on topics of importance, both based on what we hear from you, our audience, about what you want to hear, and things that we know that we hear about that are coming down the pike or that are good to know stuff our community should know that we generate. And we're always excited to have our live audience join us on these webinars. Hopefully you had a chance to ask questions. When you signed up, you can ask questions, and we baked those into the questions that we'll ask Juanita today. Also, staff is standing by in the chat, so if you have questions today, you can type it over there. If it makes sense for this conversation, we'll ask it while we're in the town hall. Otherwise, my crack team behind the scenes will do their best to answer your questions in the chat as we go forward. We're going to go ahead and get started. Again, I'm Claire Baker, Director of Communications at Beyond Celiac, and I'm pleased to introduce our speaker today, Juanita Belton. She's a physician's assistant, MPH in gastroenterology at Boston Medical Center with a subspecialty in inflammatory bowel disease. And you're an instructor at Boston University Medical Center, Dempsey Center for Digestive Disease. I was reading all that. I didn't have that memorized, so if you couldn't tell. You're also the Director of Patient Empowerment at COCCI, which is the color of Crohn's and chronic illness, and a member of the Beyond Celiac DEI Advisory Board. Just for a little background, COCCI is, and I'll let you talk more about COCCI in a second, Juanita, but COCCI is a great partner for us. They did a wonderful partnership through Celiac Awareness Month in May, created an entire web page on their site devoted to raising awareness about celiac disease. And so I love to work with partners that are really invested in both the give and the get. Like we want to be helpful and supportive of COCCI, and COCCI has demonstrated that they're that for Beyond Celiac. So I just wanted to note that. And Juanita, can I turn it over to you to introduce yourself and tell us how you became a physician's assistant, what your life is like, and anything else you want to share?
Sure. So good afternoon. I'm Juanita Belton. Like she said, I am a physician assistant at Boston Medical Center, Crohn's and Colitis Research Center. Let's see, I've been a physician assistant for 12 years this year, and the last 8 I've been in gastroenterology. For 3, I was in general medicine, internal med, and pediatrics. And then for a year, or we would call that family medicine rather. And then for a year before that, right out of PA school, I actually worked at Hampden County Correctional out here in Western Massachusetts. I worked in the male jail and also the female jail. When I first started out, I wanted to be in correctional medicine. And I would have probably stayed, but there were some other things going on in the way that things are done there. But let's see, I became a physician assistant because initially when I was younger, I wanted to be a doctor. I wanted to be a hematologist. I had an aunt who had a kidney transplant twice, and she was on dialysis. She had lupus. And I remember going with her to dialysis as a little girl, and then also seeing the machines and how they worked. I always had questions. And I'm the first, second actually in my family to graduate college. My mom's the first. So I didn't have any examples of like any doctors or teachers or anything like that. So that was my first experience with medicine. And then when I got into undergrad, and I'm very transparent about mental health. I dealt with some depression, anxiety, things like that, and how it affected me. And then in grad school, it did the same thing. And so after college, I went to BU School of Public Health, and I got my master's in public health. But in that process, I was working at BU Project Trust doing HIV testing. and a lot of Hep C testing, HIV testing, STD testing. I did a lot of education in the community. And I remember when people would test positive, which was very hard for me, but I would take them to the clinic and get them into care and those type of things. And so after that, I started thinking about wanting to be a medical provider again. And a friend of mine introduced me to the PA program or the PA profession. And I was like, oh, this fits me. And that's how I became a PA. And I've loved now gastroenterology. When I left primary care, I chose gastroenterology and I love it. I love inflammatory bowel disease. So yeah, that's me.
Well, thank you. Thank you for sharing all of that and including the mental health challenges. I know that for our community, the people with celiac disease, that anxiety and depression are right up there with the GI related symptoms. Brain fog, depression, anxiety are kind of go hand in hand with celiac disease. And we talk a lot about it beyond celiac, about the gut brain connection. So what's going on in our gut that's affecting our physical health, but also manifesting in mental health sorts of ways. And so talking about it more as just, it is a thing that many of us live with. And so how do we address that, while we're, those of us with celiac, managing the gluten-free diet, but also how are we managing our mental health along with it? Because you can't really separate your physical and your mental health.
Not at all. I have a lot of patients that we see who obviously in GI, it's even including with irritable bowel syndrome, right? There's a mental health component there with stress and anxiety. And the good thing at where I work, we have a clinical psychologist who I refer our patients to that is specific for GI diseases that I refer our patients to because we don't want to negate that that's an actual factor in people's illnesses, their symptoms and different things.
It's so great to connect it all. And I think that's really a gift of being a physician's assistant. That I'm saying that wrong. You're not a physician's assistant, you're a physician assistant, right? So just like we don't say celiac disease, so lose that extra S, but your role is to see the whole person, to can maybe help integrate all of those parts. So I think not only did you find a perfect fit for you career-wise, but I think we found a perfect fit for our conversation today. So, well, tell us a little bit about your involvement with COCCI and the work that you do there.
So I am also director of patient empowerment. I actually have 3 jobs, by the way. I'm actually director of patient empowerment there. And COCCI is an organization that was founded by Melanie Rain Blackwell, who has Crohn's disease. And she founded an organization to raise awareness about inflammatory bowel disease in Black and Brown individuals, and then also provide an organization that provides support for people of color with these illnesses. Gastrointestinal illnesses will be going more broader in the new fiscal year for more GI illnesses, but the foundation is around inflammatory bowel disease. And so in my role as director of patient empowerment, which I started in March, it's exactly what it says. I am the person that is going to help to empower patients to ask their doctors questions, to provide support to them, whether it's I don't give out medical advice, but some guidance rather, because I'm not supposed to give out medical advice. I do recommend patients talk with their providers, but also too, if you're interested in research studies, because there's a big push, and it needs to be a big push to get more people of color involved in research studies surrounded around medications and diseases. But we also provide a network where we have ambassadors, where people can come and talk with ambassadors about their illnesses, and they get support from their peers. So that's basically what I do there. I'm still getting my feet wet, but I'm enjoying it. I've been meeting our ambassadors. I enjoy having conversations. I met Erin and Bailey when they came to our Equity and GI conference. So it was nice to see them and nice to meet organizations like Beyond Celiac, where I can also have a voice as well.
Well, very good. So a big part of your work, and the reason we wanted to have you be a guest today is to talk about patient empowerment. So how do you define patient empowerment? What are the hallmarks of being an empowered patient?
So I think of empowerment as let's talk about empowerment. So empowerment is support. It's making someone feel like they are in control, and for our patients specifically, in control of their own healthcare, right? A lot of times people go to the doctors and they're afraid to ask questions. They don't know what questions to ask. It's sort of like, well, my doctor told me this, so I think I'm supposed to just follow everything that they're telling me to do. And so my role is to say, no, that's not what's supposed to happen. It's a patient-centered model. And so you have a say in how your healthcare is supposed to go. And it's not my job to tell you everything what to do, tell you everything to do. It's my job to make you feel strong enough to have your opinions, to have your questions, to say, no, I don't want to do this, or yes, I like this, or tell me more about this, or can you give me more information about this? And so that's what empowerment means to me. It's supporting someone in providing educational tools for them to make informed decisions for their own healthcare and not relying on me, the provider, to make decisions for them, or Susie down the street, their neighbor who had a similar disease, but you don't know Susie's background. And so how does this apply to me? And it's not the same thing. It's like that's what empowerment means to me. I can go into the doctor's office and say, I have celiac disease, or I think I have celiac disease, and I would like this, this, and this done, please.
What we hear story after story about people having an array of symptoms that don't have a good answer. My story was one of a couple of decades of anemia, and it wasn't that interesting, and I wasn't that sick, and it wasn't until I got a new doctor. I just decided that's how I was. I guess I just run low on iron. This was my theory because my primary didn't seem that interested. I mean, like, he wasn't alarmed. It was like, oh, that number, that's low, take iron. But there would be no follow-up after that. So, all right, I'm fine. It's fine. I'm fine. It's okay. Go to a new doctor. And she's like, hey, you're super anemic. I'm like, yeah, that's how I am. She's like, no, wrong. that's not right. Your body isn't designed to run that low. So we're going to figure this out. And it was because she took initiative, but it really was, I had just sort of said, okay, I guess it's not a big deal, even though all the indicators were that it was a big deal. So do you find yourself in a position of convincing a patient that, no, you really do need to look at this? Like, you've come to accept this as just your lot in life, but no, why don't you, let's dig a little further.
Not often. I say that because I'm saying that as a person that's in a specialty. And I say that because a lot of times people have already gotten to that point, and then their doctor's sending them to us because we need to evaluate, why someone is anemic. So I don't get that a lot, but I do get patients that come in and they want a colonoscopy or an endoscopy, and then, and it could be for, let's say, for stomach pain, which typically you're not doing a colonoscopy right off the bat for abdominal pain, right? So in that instance, I'm having a conversation with the patient. I'm getting the full history, because I'll also run into patients that say to me, well, you have the history right there. Didn't you see me talk to my doctor? And so in that case, I'll tell patients, I do have that information. However, I have you in front of me. And so I need you to tell me what's going on, because that helps me to guide me on the decision making that I'm going to have, to how we are going to evaluate this. I mean, I think you get a lot of patients in your case who, had, let's say, diarrhea for a long time, belly pain for a long time, bloating for a long time. And they're just told, it's growing pains, or maybe it's something you ate, or it's I don't know, change your diet, something like that. But I encourage that if that's something that's happening and you're not satisfied, then it's okay to see somebody else. Because you're right, having low blood count is not normal. Being chronically anemic without an explanation is not normal. Having chronic abdominal pain, if you haven't ruled out everything else, to me is not normal. So yeah.
So what barriers do you present themselves? What are some of the things that stand in the way of people, patients getting an accurate diagnosis or getting the care that they need? Um, Once they get to you, they've been referred to you as a specialist, but in your experience across the healthcare spectrum, where do you see the boulders in the path?
I think when we talk about barriers, there's a lot. I think fear is one of them. So not wanting to say I have certain symptoms because, you think that there's something wrong with you, or what if something's wrong with you? I get a lot of patients that have stomach, let's say stomach pain is just the kind of like the easiest thing to think about. And they may have it for like a year or 2 years. And then when they do come, they have fear that they might have a cancer, right? So, and that's a real fear, okay? And so they wait and they don't say anything. Or on the provider's end, the provider is chalking it up, to this could be irritable bowel syndrome. Or like I said, something you ate. And so you're not, I don't want to say not taking the patient seriously, but sometimes when you just have one symptom and you don't have like symptoms of progressive disease, whether it's like a weight loss or, nausea, vomiting or something, you don't necessarily, sometimes some providers will not necessarily jump to, well, it could be this, it could be that, it could be this. Let's do this workup. Let's do that workup. Let's do this because, sometimes the workup for things, it's a lot, right? And so are we going to put people through, I'll say $1 million workups to not find anything? But then there's a thing about a peace of mind. Sometimes patients do need their peace of mind, and we need to figure out what's going on, especially when it's been going on for a long time. And then I think also, too, lack of education, right? So 25, 30, 50 years ago, we didn't have knowledge of certain diseases, or we didn't have testing for certain diseases. And so if you don't see it so often, you also just don't know where to start. And I'm speaking as a provider. You don't know where to start. And that's not making an excuse. That's just real because medicine is a practice, right? So if you don't practice something, you don't really always know. But that's also where we need to have those conversations with our patients and say, okay, well, let's start here. You have to start somewhere. And if this is negative, then we'll do this test. And if this is negative, then refer them to the gastroenterologist or the specialist that can delve deeper. Because primary care can only go so deep. That's the other thing about primary care, hence why you get referred to a specialist.
We hear, actually, I'm going to back up for a second. So you said it was your aunt that has lupus. So you had that.
She's deceased now.
I'm sorry.
That's
But
okay.
you had that experience of, like, lupus can be hard to diagnose in that way. It can be that is a journey in itself. So do you think that informed how you approach the kind of unraveling a patient mystery of, you've got this collection of symptoms, we don't know what's wrong with you, but it could be something, and that could be quite serious. Did that personal experience inform how you practice your craft?
Part of it, yeah. The other part that I find that I think is very important is listening to people, right? Like people aren't just, we have some patients, like my older patients that come for social hour, and I love them. But most people are not just coming to the doctors because like, I just want to come, they want you to listen to what's going on with them. And part of listening is saying, okay, they have this, that, and the other thing. What could it be? What's the thing that can harm them, and what's the thing that will not harm them, right? A cancer can kill you. IBS is not. So in between, what else could be going on? Let's start somewhere, especially if someone's been having issues for a long period of time. I'm also, I don't know, I like to describe myself as like a compassionate person. Like I like people. So I want to help people. That's why I got into medicine. I would like to help people, and helping people is just trying your hardest for them to figure out what is going on. some of my patients have functional pain, and functional pain is related to just the normal function of your gut and being sensitive to that. And I often tell patients it's a real thing because I don't want to, negate people's feelings, but I want you to understand that it's a real thing and you're actually feeling real things. And there's something we can do about it, but it's not going to harm you, but it's a real thing. So just like a lot of reassurance, I just think it's important that people have someone that's compassionate to their needs. I'm probably not going to do $1 million workup on the first visit, but I am going to listen to you and I'm going to start somewhere.
Okay, so in our work at Beyond Celiac and with in our partnership with the National Minority Equality Forum, we know that there are physicians or in pockets of the country where diagnosis is likely missed based on both proximity to celiac centers or celiac educated centers and people of color just not getting diagnosed at the rate that would make sense based on population expectations for celiac disease. Do you see race, gender, age, other physical characteristics as a barrier to accurate diagnosis? And how can patients kind of manage the you couldn't have celiac disease, you're too tall kind of comments from doctors?
Well, if a doctor tells you that, go to somebody else. I'm just right off the bat, go to somebody else because, race and everything else plays a factor in every aspect of life, not even just medicine, right? Like it's in healthcare, it's in real estate, it's in education. It plays a factor in everything. And so a lot of times, because providers think that someone can't have a disease because of their genetics or their race or whatever the case may be, people are being misdiagnosed or they're being dismissed because for whatever bias, right? I mean, we all have biases and they play a role in our jobs just as much as they do outside our jobs. And I think that's an honest thing that we need to all come to reality about as well, especially in medicine. But yeah, if someone tells you that, or they're not treating you because, or you think it's because of your race or whatever, then you need to see somebody different. But it definitely does play a role. And the other piece of it is that there's a lack of education, especially in underserved populations. There's a lack of education around certain diseases because it's not so prevalent. Right. It doesn't mean that they don't happen. It's just not so common. Like in my family, I have nobody in my family with celiac disease. In my immediate family, I don't know distant, but my immediate, I've known with celiac disease and I have known with Crohn's disease or ulcerative colitis. So if I had a conversation with my cousins or my aunts and them or my uncles about this, they wouldn't know. So going to the doctors, they wouldn't know those questions to ask. And then again, going back to what I said previously about some providers, if they don't treat it, or they don't see it so often, then they're going to think that this is their first go-to isn't necessarily going to be this could be celiac. That patient that comes in with just bloating or that patient that comes in with diarrhea, they may not think celiac, and that's just because of lack of knowledge. And then on the other side, there's some health illiteracy there.
So if you're a patient or you're a loved one of a patient, so like I've got people in my family who want me at their appointments because they don't think to ask questions in the appointment. So I think of myself as an advocate for my kids or whatever. So if you're a person, you've done some research on your own, you're the advocate of the loved one of somebody who's at the appointment and said, hey, I did some Googling, which I know doctors love it when you Google stuff before you get there. But I wonder if it could be celiac disease. Would you run the celiac test? What's a good way? We know that not every doctor is open to the Dr. Google solution. So what's a good way for a patient or their advocate, their loved one, to be able to make a suggestion for what might be worthy of exploring without just like trying to tell the doctor or the physician assistant their business?
So see, that's the thing. What you just said, do that. And maybe because I'm a straight shooter, just in general, and I'm just going to ask and say, so I would consider myself a difficult patient. This is me describing myself. I'm the person that when I was pregnant and they were running late at the OB office, I went into the room with my stethoscope and did my own blood pressure and weight. I'm that person. So if you have someone who is advocating for you, just they can ask the provider, she's having these symptoms and we did some research and we're concerned about X, Y, and Z. Can you run some blood tests? There's nothing wrong with checking iron levels, right? There's nothing wrong with checking the TTG. It's blood, it's just blood work. If we're going to start with something. So I would say, don't be afraid to say, I was doing some research. First of all, I'm glad you were doing some research around what could be going on, and that you then took that research to someone with some knowledge about it, right? Like, reward yourself because of that. And then be okay with saying to the doctor, hey, I would like, or I think, or what do you think about this? These are my symptoms. What do you think about this test or that test? Or would this make sense? I have patients that say, can I have an MRI? And I'll ask them, why do you think you need an MRI? And they might say something. I say, well, this is probably a better test. So let's start here. But I don't know unless we have the conversation. So feel empowered to ask your provider or your advocate to ask your provider. I have a lot of people that come in with their family members, and I'll have conversations with all of them. But feel empowered to ask for something, even if the test is negative. It helps with your peace of mind that, okay, it's not this. Just ask.
And it's different to go in and say, would you run the celiac blood panel, or would you do an endoscopy and biopsy? One is super expensive and not the first appropriate step. And the other one is blood test isn't that expensive, and it's the right place to start to see if you're at risk.
Exactly. The thing about invasive studies, and it's not just an insurance issue. It's, you're put under anesthesia, so there's risk of that. There are sort of steps to get to that point before you go to something invasive like that, with other risks that a blood test doesn't have the same risk. So yeah, start there.
So if you're a patient, so have you put on your patient hat? Imagine you go to your doctor and you're not feeling heard. What do you do? I mean, you've just described you're very strong. You're your own advocate, and you know the healthcare world. So I guess this might be a stretch of the imagination, but let's say you move, you get a new doctor, and you say, "Hey, this is what's going on." Your doctor's like, "No, that's not it." What steps would you take? At what point do you say you're not the doctor for me? How quickly do you fire your doctor and go get a new one, that sort of thing?
I think that if you've had a thorough conversation with your doctor, and they're just adamant that this is not what it can be, this is, this, I don't think you need this, and they're just not meeting your needs, then at that point you should find a doctor, because you should remember that you are the patient. And so it's your health, it's your body, it's your one life that you have. And even if it might be completely nothing, if it worries you and you don't feel heard, then that's at that point, you need to see someone else. I mean, I've had patients where, everyone doesn't like me 100% all the time, and that's okay. And I've had patients say, you know what, if you're not comfortable with what I said, you can see one of the docs, or you can go somewhere else. And I'm not offended by that, because I think that if you don't feel sure or secure in the relationship that you have with your medical provider, then you should see someone else. There's nothing wrong with second opinions and third opinions. Now, if you get to the fifth and they all the same opinion, then, that's something different. But if you don't feel secure, or you feel like your needs are being met, then yeah.
We've heard stories from our community that they didn't get a celiac test at some point, but a doctor said, you know what, I think you're a psychiatric case. That that usually sets people right off, because they're like, no, 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 you're not hearing me, you're not taking me seriously. But then they get this note in their file that they're a psychiatric case, which then kind of follows them around. Do you have any advice for how to manage that kind of a situation?
Mm, You, not really. Um, Maybe talking to the provider about what they wrote in the chart. That's kind of harsh.
Yeah.
Um,
I
that's kind
wish
of
I
harsh.
wish I were making that up, but I would,
Yeah, I mean that's unfortunately. I would wonder if you can talk with like so most hospitals have like a patient advocacy office. So maybe start there. Um, yeah, I would say maybe start there, especially if it's not a case of a psychiatric nature or something. Yeah, I would start there because that's kind of detrimental and very negative to put in a, unless there was something that really happened like that or something, but just because of whatever. Do you mind if I address something that was put in the
please.
chat? I'm actually looking at the
Oh
chat.
yeah, yeah, no, go for it.
Yeah, so it just says SWE. You are absolutely right. I think there are a lot of biases in the medical community. I think just in life we all have our biases just as human beings. But I also understand that, it isn't easy always to find a new doctor. And yes, that can take months. And that's more insurance and more availability of the providers, unfortunately. I mean, I think if we all could open up our schedules, we would love it. But unfortunately, it is hard to just leave a doctor and get a new doctor. But if you can and if you are not, but at the same time, if you're not feeling heard, then you got to do what you got to do, and keep fighting for your son. I see what you're saying, and he is worth it. That's why you keep fighting for him.
Yeah, thanks. I hadn't been reading chat because of focusing on you. So thanks for jumping in there. And
That one just kind of stood out to me.
yeah, yeah. Well, and with celiac disease too, just to kind of close out the previous part, there are enough psychological manifestations with celiac disease that you can imagine that, oh, you're depressed, go see. The connection between your gut health and your mental health isn't always well recognized. So it's easy to imagine how we don't see it. We don't see it in your physical workup. Or maybe people just think, oh my gosh, I'm so depressed. And they don't recognize that physical symptoms, if they have any, they don't recognize them as physical symptoms, that maybe there's something wrong, and they go the wrong route to try to get an answer.
Yeah.
So let's see, how can people with celiac disease, and you can broaden the tent to other GI related diseases, but how can people with celiac disease become more empowered in managing their condition day to day? Or if you're a caretaker for a child or another person, how do you just deal with life even if you're not going to the doctor?
So you have great organizations like Beyond Celiac. It sounds like a plug, but no, here's the thing. You have great organizations like Beyond Celiac or like COCCI or like other organizations that provide support and assistance to people that have these diseases, because you don't want to feel alone and you don't want to feel like you can't ask questions. And then they also have, like, Beyond Celiac also has ambassadors as well that you can talk to who can relate and just answer questions that you may have. So I would say someone like that or something like that, you utilize the resources that are there because you're really not alone. And being on this forum, you understand that, Beyond Celiac, for example, has all this information, whether it's through education about research, their peer support, answering questions about the disease, symptoms of the disease, even finding providers. You can go to their website. And so I would definitely utilize those things, because if you think about it, before the World Wide worldwide internet, we kind of lived in silos as it related to diseases, right? You had encyclopedias. I had Britannica encyclopedias. I'm aging myself. But now you have this abundance of information. And I know that you can call these organizations and get support with whatever's going on with you, including mental health. A lot of these organizations on their websites also have information about what finding mental health providers, because for me, they go hand in hand with disease. So I would utilize organizations as sources of support. And it can be one-on-one, or they might have groups. Like in my hospital, we do groups for peer groups for like IBD patients. So a lot of places have peer support groups, because you want to, the thing about diseases is you want to talk to providers. That's fine. But then also too, people want to see people that look like them, that are around the same ages as them, that race, ethnicity as them. I'm getting tongue tied today, but race and ethnicity as them, because the experiences might be different. So you want to find organizations that can provide that type of support, and people that can help you, where you can say, I'm having a really bad day today, or I'm having a lot of diarrhea today. I'm having a lot of abdominal pain today. I'm feeling weak today. What do you do? Or what can you suggest? That's non-medical. Sometimes it's the non-medical things that people need.
Sometimes, they just want to be heard. They don't,
Right.
You don't necessarily have to go to your doctor to find somebody who's going to listen to you, who will listen and really see you and really hear you. And maybe that's all you need. I mean, if with celiac disease, it's 100% diet controlled experience right now. So you can only do your best. And even the most experienced of us make mistakes. We know that though, so our surveys tell us that, between 10 and 12% of the people diagnosed with celiac disease will intentionally eat gluten at least once a year, which shocks me, because I know how symptomatic I am. I cannot imagine what would be worth doing that. But some people do. People report it. What would you say to them, the people who are intentionally choosing to eat gluten at least occasionally?
You're human. I mean, let's think about it this way. I go on a strict diet. I have to go on a strict diet. That means I eliminate a whole lot, right? Mm-hmm. That can be hard. That was such a simple way of saying that. I looked like I was going to say something really prolific, but no, that can be really hard, right? Think about when you just go on a diet to lose weight, and you like, oh, I can't have a cheat weekend. I can only have a cheat meal. So what I tell my patients who do that, or even my patients with acid reflux, who know that if they eat hot sauce and spicy food, they're going to have reflux and their stomach's going to hurt and they're not going to feel well. Just know that when you eat that, this is what's going to happen. I'm very upfront with my patients, by the way. So just know that this is what's going to happen. And if you're okay with that happening and you having these symptoms, I can't make you, not do that. I prefer that you avoid the things that make you sick, make you not feel well. But I can't I'm not going to take your joy away, but I am going to just educate you on, like, this is what's going to happen. I'm not angry with you. I can't do that. That's your life, but you're a human being. And sometimes you want what you want when you want it. You just have to deal with the consequences of wanting what you want. And no judgment.
Yeah. And the reality, and maybe some of it is education, because you don't really know if I ate gluten and I had no symptoms, I would think nothing bad was happening, but I don't really know what's happening in my small intestine. So if there is, if you don't know what's happening in there, you just don't know. So you're like, oh, nothing, I didn't have any symptoms, maybe it's fine, but that's a big maybe. And so just be informed, I think. Yeah.
Right. But I also think that piece of it, because, we've got patients that have symptoms, but you're right. The people that don't, I think a big part of that, comes with understanding what celiac disease does to the body, and understanding that, you know, if I eat this continuously or periodically, this is what's going to happen. And that's a conversation that your provider should be having with you in the beginning, so you have a thorough understanding of how certain things affect your body with certain diseases.
Right.
Like, you're
Right.
just not able to break down certain things. And so this is what can happen, and this is what it can lead to, whether it's the anemia or the weakness or anything.
Right.
So it's having that informed, having information to make an informed decision.
Well, and that ties into a question that I see in the chat about misinformation online and how to know the difference. And we at Beyond Celiac are all about evidence-based information. So my answer to that is always find your trusted source, and don't just go with the top thing that pops up on Google. Make sure it's a trusted source. Do you have any other tips for making sure that the information that you're finding online is good stuff and not just the latest bad?
I mean, I agree with what you said, but I also, piggying back off of what I previously said about like organizations. When organizations post things, they're peer-reviewed studies. They're information that has been vetted very well within, a medical community, medical providers, people with expert knowledge. So when I say go do, those are places that I would go for specific information or resources. There's so much on the internet that I don't even know what's good and what's not. As a provider, I have access to like up to date, so I'm able to read peer reviewed things, or go to like something like the American Gastrointestinal Association, or Beyond Celiac, or COCCI, or Crohn's Disease Foundation, those type of organizations that have that information on there that is good information. So that's what I mean when I say use those resources, because you know what you're getting. And I meant the Crohn's and Colitis Foundation.
So as we are, we've got a patient community, diagnosed patient community that's engaged with us. How can we, what advice would you bring from either a community organizing point of view or a community advocacy point of view? How can a regular person make a difference in improving the lives of other people with celiac disease or whatever condition is that they might be advocating for? Do you have any ideas there?
Talk about it. Seriously, talk about it. Talk about your experience. Talk about, so that someone who doesn't know can say, hey, what's celiac disease? Who also might then say to you, wow, I've been having X, Y, and Z for this long. I didn't, this amount of time. What do I do? And so you, who's been diagnosed or has been dealing with something, can say, you should go to your doctor and ask them about X, Y, and Z. Talk about it. What you don't say can kill you. So when we were at the Equity and GI conference, one of the providers said about family stuff. You know how a lot of times in families they don't talk about the disease Aunt Susie had that killed her, that could probably potentially be genetically transferred and stuff. And so, have conversations with people, be involved with an organization, become an ambassador of some of these organizations where you're able to, go into your community and do community events and talk about the disease and advocate for people with the disease. Legislation, look and see in your city what legislation is in place for health issues that might be something that you want to be a part of. But there are a lot of ways to get involved. And so again, I'm going to say, go to these organizations, because why reinvent the wheel when you can go and say, I want to do something in my community. Can you help me? And if they're a good organization, then they'll help you to bring awareness to something, a disease in your community that maybe your community doesn't know, but you might be surprised how many people are battling something and need your push for them to talk about it or to get diagnosed with it.
Great stuff. Yes. And if somebody is listening and interested in working with the Beyond Celiac, Reach Beyond Celiac Ambassador Program, then then we have a place for you. And not everybody can necessarily spend the time to do that sort of thing. But so we also have our Voices of Celiac opportunity, where you can just write your story and share your journey to diagnosis. And it's been very illuminating to see people's individual stories, what how easy or hard it was for them to get diagnosed. And then we Beyond Celiac are able to share those stories more broadly, and that increases the likelihood that people will see someone like themselves, just like you were saying earlier, like, oh, she looks like me, like, oh, I see, yay, I'm not alone, I'm not the only one like that, like, oh, that's so valuable. We're, as a nonprofit, we fund our work through donations. So there's always the opportunity to donate to support our work to accelerate research for treatments and a cure. So there's a lot of ways to help. And sometimes you just might need to be a little creative about finding a fit that's right for you and your time and your resources to be able to help. But sometimes it's as simple as sharing material on social media, amplifying the message from the organizations, and just kind of being out there talking to your family. It's family reunion. Hey, I've got celiac disease. There's a genetic component. You're at greater risk just because you're related to me. So next time you're at the doctor, even if you don't have symptoms, suggest the celiac panel. Add it to your blood work. It's just a blood test, and so take the stuff out of it there.
And the just real quick, the important thing that you said, at least with the family thing, with the family piece of it, just make sure that everyone in your family you're having conversations with your family about their health issues, period. Not even just you talking about yours, but that everybody's able to, because then that does help your provider kind of direct, for example, colonoscopies. If you had a mom or dad or a grandparent or something, or sibling, it's good for us to know. If someone had stomach cancers, it's good for us to know, because depending on where you come from with the history of stomach cancer in your family, you actually might need an endoscopy, especially if you're having like lots of reflux type thing. Like, it's all these different things that if we know, then we can kind of direct things.
It's all part of the puzzle.
Yeah, and SWE, if you got to be the celiac info lady, then be the celiac info lady. You have celiac. It's okay.
All true. All right. So one question that might have come in: how do I deal with people thinking of me as just that picky eater? People just think I'm picky.
Tell people to mind their business. Like, no one needs to know why you didn't eat that rib or that piece of bread or something. That, like, nobody needs to understand that. Maybe you didn't like who cooked it. When I go someplace, I need to know who made all the food, because I'm not eating everybody's food. It just is what it is. Like, people, if you don't want to share your stuff, you don't have to. Don't feel obligated to share your stuff. If you're someone that wants to bring awareness, or you feel like it, fine, but understand that your stuff is still your stuff. And you still have to create boundaries around your life, your healthcare, and every aspect of you. And you can let only who you want to let in. But like, it's a barbecue. I don't care if their eyes roll your eyes back.
I would say no is a complete
announcement.
No is a complete sentence. That's what I've always loved. Would you like this? No. No, thank
you. Period.
No.
Oh, you know what? I learned also helps with people off your back. Tell them you get diarrhea. Nobody's asking you any question after you tell people you have diarrhea.
They're like,
yeah.
All right. Well, do you have any additional closing thoughts? Any more words of wisdom for us before we wrap up?
Sure. I love the words of wisdom. Here's something else. You get one life, one body. Take care of it. So if you have questions about it, ask. Don't be afraid. If you need resources, you have an abundance of organizations like Beyond Celiac, like COCCI that you can go to for your GI issues. You have opportunities to become ambassadors. If this is what you want to do, you know, advocating is what you want to do and speaking out. But don't feel obligated to share everything, but share everything in your doctor's office because that's how we can help you. And if you don't feel like you can ask the questions, bring somebody with you who can ask those questions or who you feel confident enough in asking. But it is your life, your body, and you're the one responsible for it.
Thank you so much. This has been a wonderful
Thanks for having me, Lucy.
conversation with Juanita Belton, a physician assistant who is who works with our wonderful partner COCCI. If you've listened to this or watched this on replay and you're interested in sharing your story, I invite you to go to beyondceliac.org/voices, and you'll see a little button there where you can share your own. You can scroll through and check out all the stories from the hundreds of people who've shared their story with us. And with that, we'll wrap it up. Have a great rest of your afternoon, and thanks again, Juanita.
Thank you.